Below are 10 conditions that can cause one to have photophobia, that is photosensitivity. 1. Cerebral malaria, a concern for travelers in malaria-prone areas, shows symptoms such as fever, lethargy, and neurological signs. It's caused by a parasite called Plasmodium falciparum and includes high temperatures, low blood pressure, yellowing of the skin, breathing difficulties, and bleeding. Cerebral malaria is defined by changes in mental status or repeated seizures. While stiff neck and sensitivity to light are uncommon, there may be symmetric brain dysfunction and issues with motor control. 2. Meningitis can be a rapidly progressing or gradually worsening infection, marked by fever, headache, and neck stiffness. Over 75% of patients experience reduced consciousness, ranging from tiredness to coma. Bacterial meningitis typically includes fever and either headache, stiff neck, or altered consciousness, often with nausea, vomiting, and sensitivity to light. 3. In viral meningitis, immunocompetent adults often display symptoms like headache, fever, and irritation of the membrane surrounding the brain and spinal cord. Headache is nearly always present, often described as frontal or retroorbital, with sensitivity to light and eye movement pain. Nuchal rigidity is common but mild, along with signs like malaise, muscle pain, lack of appetite, and mild drowsiness. Severe changes in consciousness suggest encephalitis. 4. Oculocutaneous albinism, caused by a lack of tyrosinase, leads to reduced pigmentation in hair, skin, and the optic fundus. People with this condition suffer from impaired vision and light sensitivity, known as photophobia. 5. Lyme disease, transmitted through tick bites, initially shows a rash erythema migrans that evolves from a small bump to a large, red circle. Symptoms like headache, muscle pain, chills, and later issues with the nervous system and heart may appear weeks to months later. 6. In acute meningitis, embolic lesions appear on the trunk and extremities, often turning gray. Sizes vary, with associated signs like prior respiratory infections, fever, and inflammation. Disseminated gonococcal infection involves inflammatory lesions, purpura, necrosis, joint pain, and fever. Rocky Mountain spotted fever, caused by Rickettsia rickettsii, manifests with fever, headache, and light sensitivity, followed by a rash. 7. The fever and myalgia syndrome, often linked to zoonotic virus infections, leads to sudden fever, muscle pain, and discomfort. Headache, sensitivity to light, and pain behind the eyes are common. Physical findings are minimal, lasting 2 to 5 days, with variable severity. In remote areas, diagnosing meningitis is challenging due to light sensitivity and muscle pain. Some cases involve a rash or aseptic meningitis. 8. Primary amoebic meningoencephalitis (PAM) results from water-containing amoebas, often affecting those who recently swam. After 2 to 15 days, symptoms include severe headache, high fever, nausea, vomiting, and sensitivity to light. The prognosis is grim, with most patients succumbing within a week. 9. Migraine, a prevalent cause of headache and neurological issues, affects about 15% of women and 6% of men. Characterized by episodic headache, it includes sensitivity to light, sound, and movement, along with nausea and vomiting. Migraine has 3 phases: warning, headache, and recovery, each with distinct symptoms. Recognizing triggers, like stress, light, or certain substances, aids in managing lifestyle. 10. Cluster headache, affecting about 0.1% of the population, involves intense, non-changing pain, typically near the eyes. It follows a pattern, with daily attacks for 8 to 10 weeks, followed by nearly a year of relief. Chronic cases have less than 3 months of remission. Attacks often start at night, and men are affected more than women. Unlike migraines, people with cluster headaches often move during attacks.